Hey guys, and welcome back to another session of Strength for Dance. Today we are going to be looking at one of our vital basics really, which is posture. So what we want to be achieving is as close to perfect posture as possible, and seeing if we can hold that or be able to achieve that, I would say to about 80% of the time. Having a perfect body alignment is not an achievable goal, and certainly not for 100% of the time. But if we can aim to have a good centered body and good alignment for about 80% of the time, our body can then mop up the excess for the other 20, and we're not going to get pushed over our tissue threshold and enter into the world of injury. Now, when we're looking at posture, in clinic or as a physio or Pilates instructor, I'll be looking at perfect stack alignment. From sideways on, we look at this termed as plumb line. From front on, or when we're looking in a frontal plane, we're also looking for levels or platforms throughout the body that are going to be symmetrical and well aligned. And then we can also look at our body adaptations in transverse plane, which is looking at our twists and torsions. So let's have a look at sagittal plane and plumb line.
Sideways on with posture, we want to have a line or imaginary line running from the tragus of the ear through mid-axilla or armpit line, mid-ribs, that bony bit of your hip, which is your greater trochanter, and it comes down and sits just in front of your ankle bone or lateral malleolus. This is a stack line that shows variation or deviation in sagittal plane. So if we are stacked, our joints should all be nicely placed on top of one another, and our muscles should be nice and relaxed. From front on, the deviations we can see here in frontal plane might be a hip hike. Now this might be due to a proper leg length discrepancy, so a taller leg, or it might be due to our weight being transferred over, so our center of mass is towards this leg, and that can also give a hike. We might also see that the rib cage is shifted a little bit, so a drop on one side and a lift on the other. This will lead our shoulders to look like they're at a different height too. Majority of the time, if we're looking at shoulders and we're thinking, I don't look straight, I want to try and lift this one, we need to go down and look at the rib cage. Our head might also be tilted a little bit as it sits on top of the neck. So what we're looking for here is even pelvis, even ribs, even shoulders, and an even head and jaw. That's our frontal plane posture. We then have transverse plane as well. So like I said, these are our twists and torsions. So is your pelvis facing forwards? Or are these two bones, your ASIS or front of pelvis, facing off a little bit? Are you facing stage left or stage right? Where is your rib cage? Is that facing off a little bit? And your head can also have a slight tilt. Now, if your posture, you are a little bit twisted here, your rib cage will come back again to face front. Your eyes always want to face front. So no matter where your posture deviates to, your eyes will be facing forwards. So even if you have a huge deviation over here, your eyes will still be forwards. Same with our sagittal plane deviation. If your pelvis is forwards, your ribs back, you'll still have your eyes forwards, and this gives this poking chin view. It's the deviations here in our sagittal plane that we're going to have a look at first. So a very typical deviation seen with the dancer is this hanging forwards into the hip ligaments. So the pelvis comes forwards of midline, the ball and socket of the hips come forward of midline. The chest, if it was to stay stacked, would end up here. However, we still need to function and stay upright, so the chest comes back of midline. The head Then we'll come forwards of midline. So we end up with this snaky curve. Closing at the base of the skull, closing in the low back, closing in your upper abdominals, and shoving your hips forwards in their sockets, which isn't an ideal alignment for anybody. But again, this is one of the very common injuries we see with dancers, anterior hip impingement, and posture has a huge feedback into this. One of our other postural alignments is our excessive lumbar lordosis. So that's with the pelvis that way, tilting here. So the pelvis forward tilts or anteriorly tilts, usually coupled with hyperextended knees. And once again, the chest will come back to accommodate slightly forward head alignment. I know if I was left to my own devices, this would be how I'd be standing. The lower abdominals then are relaxed, can sometimes look a bit bloated. Again, we have tightness here towards the upper abdominals, very tight throughout our back extensor muscles. And the shoulders are a little bit rounded, just as they are with our forward hip placement variation. This is actually your sway back posture. Forwards, hyper, slumped, as opposed to that one. Hyper, forwards tilt, arched back. With our side-side posture, if you stand on one leg, you're going to cause discrepancy or a change in the pelvic height here. High on this side, low on this side. Corresponding, shorten. So we have a very short waist here and a long waist here. And the shoulders are probably dropped a little bit. If we stay like this over time, we can end up getting tissue changes in the side of the hip. They become a little bit longer, and also we can get thicker tissue laid down here. The neck will also be on a slightly different level. So maybe we can get neck injuries here as well, or it's that tightness feeling that we get. This puts our spine in lateral spinal curves, and this is called a scoliosis. So this is just a functional scoli. And if I come on this side, I have a functional scoli on the other side. If I spend 80% of my time standing like this, my body will start to adapt. I will get used to being on my left leg. I will get used to the hike. I will get used to the shortening. So even if I then try and stand parallel, I might be a little bit that way inclined. I have adapted. This then means that I'm no longer symmetrical and my joints don't sit in center. So let's look now at how to set up a good posture. We're going to start with our feet parallel and underneath the hip joints. Ball and socket sit here, hip width or greater trochanter here. We're going to think about tripod foot alignment, even weight, heel, first toe, fifth toe. Knees will be soft. If we snap the knees back, it tilts the pelvis forwards, so we want them just softened. We're going to think about our pelvis in its middle position. Pubic bone, two front pelvic bones, vertical. We have our breastbone over our pubic bone, so we're stacked. We think of our collarbones being broad and lengthened. And we think of elongating under the base of the skull. So once again, from side on. Feet parallel, close together under the hips. Knees soft. Remember, if they're snapped back, you get that deviation. Also, when you hyperextend, your knees internally rotate, which is not what we want. Once we find middle, we're going to stack the breastbone over the pubic bone, broaden our shoulders, and create space at the base of the head. Then just check in with your breathing again, and this should be a very light, floaty stance. Nicely stacked, minimal muscle work, just a little bit of core activation. We'll also find that there's a little bit of a shift around. That's fine, that's called postural sway. Maybe have a check-in as well through the underside of your feet. 2 front quadrants, 2 rear quadrants. Where is most of your weight distributed? So if your weight is forwards, there's a chance you might be here with your posture. If your weight is backwards, you might be here to try and accommodate. If you have a rotational picture, so front right, rear left, it will give you an indication that you are torsioned and twisted in your posture. What we're looking for is nice even weight, all 4 corners, 25% in each, with good contact with the toes and nice feet that are accommodating onto the floor.
So to start working with your posture throughout the day, maybe check in at various times throughout the day. Maybe you check in when you wash your hands after the toilet, when you're cleaning your teeth, or if you're a coffee drinker, maybe when you're waiting to get your latte or cappuccino. You actually go in, you do a body scan, you check in how it is that you're standing, and then at least it'll start ticking in throughout the day. Maybe you do this when you're in class, you're listening to your teacher talking. Definitely you need to think about this before you're going into auditions and competitions. Posture and emotion has a huge connection too, which we'll look at another time, so it can really get you in the right mood for what is you're going to be doing. So, pop off, have a little assessment of your own posture. Where are you currently? And you may find it changes day to day. See if you can find a good posture or good alignment, and just start practicing. Drip feed it in throughout the day. I hope you enjoyed.